finally, I'd like to go into a very interesting and promising avenue in squamous non-small cell lung cancer. I began today telling you that anti-PD-1 strategies look like they work in squamous non-small cell lung cancer, which is very exciting. And we saw two reports in two separate oral sessions, one in the early stage session and one in the metastatic lung cancer session, both showing us very similar data in squamous non-small cell lung cancer and promising targets, one from Dr. Govindan, one from Dr. Pack at Memorial Sloan Kettering. The Cancer Genome Atlas, or TCGA, is doing a comprehensive sequencing of DNA, RNA, promoter methylation, whole genomes on many patients. Because they're doing such comprehensive work, they need frozen specimens and high-quality specimens in the early-stage patients. Memorial Sloan Kettering has taken a different approach and are doing more targeted molecular assays, including the snapshot or sequenome molecular-based assays, fluorescence in situ hybridization, which is the same test used for ALK and ROS1, of FGFR1, which has previously been shown to be a promising target, been doing immunohistochemistry for expression of PTEN, and then on selected samples doing next-generation sequencing and copy number analysis. In the Memorial data, the big difference between these two studies, in addition to different techniques, is different patient populations. One is stage 4 and one is mostly not stage 4. One slide to compare the two, and what they see is out of the targets that both of them looked at, PI3 kinase, the constitutively activating mutation, they see similar numbers. TCGA sees about 16%, Memorial sees about 8%. PTEN, which is a protein also in the PI3 kinase signaling pathway, mutated or deleted in up to 30% of patients in stage 4 and 15% of patients with earlier stage. FGFR1 amplification, which was previously reported by the TCGA a year ago at the World Lung Conference, their previous number was about 25%. This has now been reduced with a larger sample size to 15%, but corresponds similarly to amplification of FGFR1 in the Memorial data. DDR2, which is another previously reported mutation, may be sensitized to dasatinib as a targeted agent, was reported at about 4% frequency in TCGA and not seen in Memorial Sloan Kettering's analysis, at least on the whole genome level. KRAS mutations were seen at a very low frequency, and this may reflect that some of these patients had adenocarcinoma or CROSS. So I think overall there are a host of promising targets. In TCGA, the other targets are of unclear targetable significance, things like EGFR amplification as opposed to the mutations that we've been talking about, or FGFR2 mutation. We're not sure whether these are all targetable or not, and that will be the question to be proven by prospective clinical trials. But now we've started to identify a bunch of recurrent common alterations in squamous non-small cell lung cancer. So in conclusion, molecular targets in squamous non-small cell lung cancer, including FGFR1, on which clinical trials are ongoing and being designed, and others are definitely attractive targets.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support. Thanks again.